I'm so excited to sit down with you today and record this episode in person. It's my first in-person interview, so I'm really excited to have the chance to speak with you. And I've just been a fan of you and followed you for a long time, and what you and your team have created, it's just incredibly impressive. So I'm so grateful to have the time to speak with you today.
Thank you so much. I'm so excited to be here today too and to meet you in person.
Thank you. Thank you. So I know that many of our listeners will already have come across your work, most likely through your social media presence, where you are very active and produce some really, really great informative content. But for those of our listeners who maybe aren't familiar with you, would you like to introduce yourself and your clinic and what you do?
Absolutely. So my name is Julie Sarton. I have a doctorate in physical therapy, and I own a practice called Sarton Pelvic Healing. We just morphed and changed our name into that. So we are a pelvic floor physical therapy clinic that treats all aspects and forms of pelvic floor dysfunction. I have been a clinician since 1996. So I was just sharing with you, I'm about ready to celebrate 30 years. A wonderful journey, and I've seen so much change since I started practicing, both in the profession of pelvic floor physical therapy as well as like within my practice too. It's just evolved so much over the years. And we're located in Southern California in Orange County, and we have our flagship clinic it's called Tustin, California. And then we have a satellite down in South Orange County in Mission Viejo, and we love what we do. I have an incredible team and so blessed to just also be able to reach patients both in person and online through like all the social media education that we do, and then through our international program now where patients fly in.
Yeah, fantastic. And when did you start actually doing more of your social media stuff and being more active there? Because you've grown a really, really big presence, and it's just truly impressive. So how did you come to start with that, and when did you start?
So, gosh, we started probably 8 or 9 years ago. We were just dabbling. And so I had to learn quickly because like this wasn't part of my generation. And so it just kept slowly increasing where we realized that there were so many questions to be answered. So I put more time and effort. And then really, I also hired expertise because I am not that tech savvy person. So as we brought in an expert to help with more of the technical side too, and like help with graphic creation, I was able to use my creative side to like bring in kind of what we're seeing in the clinic to people all over. I think these questions of quote taboo topics that I wanted to definitely help champion and bring more answers to. So we like to kind of bring in if you've seen any of our videos, like kind of just like, I always just call it kind of like a nerdy, corny, twist, because if you can't laugh about it, right, it makes you want to cry.
I completely agree. And I think it really shines through. I think you put words to what I experience in your content as well, which is it is quite light-hearted, but then at the same time also very in-depth.
Yes.
I often feel like a lot of the information out there is quite reductive as well.
Yes.
It's like oversimplifying things.
Yes.
And then we're left with so many like questions unanswered. And I think you and your team do just such a good job of addressing that gap. I think you're making a real difference by doing the work that you're doing.
Thank you. So greatly appreciated.
Yeah, likewise. All right. So for today's episode, I wanted to focus on the everyday habits. So the small things that we do often without thinking that can either create or maintain pelvic floor tension. And I think this is a recurring theme in our community, and so many of our listener questions are often about what either helps or hurts pelvic floor health, and kind of knowing that pelvic floor dysfunction is often a common denominator for people with vulvodynia and vaginismus.
Yes.
But the questions aren't just concerning kind of what are the exercises or treatments that people should be doing, but also actually like how does it matter how we sit, how we move, how we breathe, etc. All these like small details that I think are quite interesting.
Yes.
So to start us off, I was wondering if you could start by sharing what are some of the most surprising habits that might contribute to pelvic floor tension. So maybe things that people might not ever realize are actually connected to pelvic floor health.
Such a good question. I love it because it's so practical. And so I want to start with like the simple things day in and day out, right? That we all do. So let's dive in with actually bowel and bladder functioning.
Sexy.
So, yes, literally before we started this recording, we were in the bathroom and we were in stalls next to each other. And you didn't know, but I was listening to see how you peed because it tells me a whole bunch.
Only a pelvic.
So, right? Didn't want to put you on the spot in the bathroom. So, bladder. Okay. So, one of the key things that I always love to ask every patient that comes into our practice or anybody out there who wants to talk about it is tell me how you pee. And I don't like to preface it by too much. I just want to, and they're like, well, what do you mean? How do I pee?
Yeah.
So then the next question I would ask is, if they don't know how to answer that, is, do you push your pee out or do you let it naturally come? And so this was a question I missed for years, like when I was initially younger and doing pelvic health, but I ask everybody now because there are so many patients that push their urine out and it's called a Valsalva voiding technique. So as they do that, what happens is the pelvic floor actually will contract, and then they're using intra-abdominal pressure to get all the urine out of their bladder, whether, again, regardless of what gender they are, because they're like, well, I don't know if I fully emptied, or well, maybe I'm in a hurry, right? Oh my gosh, I'm late. So when we push our pee out or our urine out, we're training on the brain level, the pelvic floor to be active when at a time that pelvic floor should actually be relaxed and elongated and lengthened. And so now from a neuro perspective, we're learning a faulty pattern. And so what can happen after time is that the bladder itself will start to develop a stop-start flow pattern. So it's the bladder, the detrusor muscle has to relax and open, but the pelvic floor actually also has to lengthen to allow for the sphincter to relax too, and for the passage of urine to come through the urethra, the tube, right? So if we're activating to like, okay, time to work and get this urine out, again, confuses the brain, confuses the muscle, confuses the pattern and the sequencing of firing neurologically of what's supposed to happen from both smooth muscle and skeletal muscle perspective. Yeah. So pushing out your urine is like a
okay. Interesting. I've never thought of that. I never thought of people like rushing in that way. I wonder if I do it now. I don't think I do.
Good. I didn't hear you do it.
Okay. So in that case, I mean, is it typically tied to pelvic floor tightness for people who do that? Like, is it the chicken or the egg?
Yeah. So if you have tightness or hypertonic, what we call hypertonic pelvic floor, patients or people out there, not just patients, but may not empty their bladder fully and completely.
Yeah.
So then they're like, oh, I still have what we call a post-void fullness. Like, oh, I still sense that there's urine in there. I'm not fully empty. And so commonly people I'm going to just force that out, right?
Yeah.
So, which is not a good habit, again, because it will actually backfire and then feed into more tension. So the same thing with actually bowel too, right? So if we are straining to eliminate and have a bowel movement because we're constipated, it will backfire. And that, again, you're doing the same principle of let me contract the pelvic floor, I'll use intra-abdominal pressure to like force the elimination to occur. And unfortunately, what will happen then again is the pelvic floor gets used to being in this overly active state, more at rest and associated with that event. So straining with bowel elimination also.
Yeah.
Bowel and bladder, no pushing, no straining.
So we should sit down on the toilet, really take our time, relax, chill.
Yes. You want to exactly think about a couple things, right? Where posturally, like where are my knees compared to my hips? There's something called the squatty potty that a lot of patients use, and we have it in our clinic. So it gets your knees actually higher than your hips. And so it's almost mimicking a squat position, which puts the pelvic floor in state to lengthen automatically and relax. So it will change and facilitate even the colorectal angle. So we're not sitting in a 90-degree angle, and it just opens up the chute. So it's like full elimination, not having to stress. Breath work, like you said. So our pelvic floor is governed by the autonomic nervous system. And so the more we're in like fight or flight, sympathetic nervous system overdrive, right, the more, quote, on the pelvic floor is and active. So that is an underlying driver. So some deep breaths, some vagus nerve work can also help with better elimination.
Like some humming?
Yes.
I know my vagal nerve.
know it. That's so good. Yes. Humming on the toilet would be great.
I'm gonna start doing that. Sounds like a chill to relax.
Get those lips vibrating. Feel the vibration, right? No
Okay.
breath holding. Just, yep.
Okay. Good actionable
So, like, simple because,
tips
I
there.
mean, we pee and poop all day and every day. Hopefully, we should be, like, pooping. So,
Yeah.
multiple times. So, that is, like, a easy one, right? Where we go, all right, we're all doing that. Let's do it right.
Yeah.
Let's
Okay. Very
to help the
good.
pelvic floor.
So that's one of the first things that you ask.
One of the first
Coming to
things,
the
yeah,
clinic.
and
Yeah.
just a very quick win, simple thing that you can integrate and you go away with.
Yeah.
Yeah. So another thing would be then, speaking of postures, so we look and we want to analyze and just see, what are you doing throughout the day? So it's interesting that we treat a lot of like dental hygienists or dentists who sit on stools, rotated, sitting like with weight bearing more on one sit bone or ischial tuberosity, working for long periods of time in these postures or spaces, right? Where they're doing a root canal or whatever they're doing, right? So now we have an asymmetry with what's happening with how the pelvis is sitting, how the pelvic floor is loaded on one side. So we want to always explore. So if you're going to be, first of all, sitting for a long period of time, we want to just bring some awareness on how that looks. And please try not to maintain those static postures. If you're going to be in that, you've got to do something to counteract that.
Okay. And static, how long are we talking then? Is it like 10 minutes, 15 minutes?
Depends on the person, right? And where they come in.
Yeah.
We have some people that can get away with a lot more if they don't have a history of a significant dysfunction. And they're like, oh, well, yeah, I did just fine on that 8-hour plane ride. But ideally, I would love for people to get up and get blood flow back to the pelvic floor, decompress the pelvic floor. But then we have patients who that 8-hour plane ride would destroy them. Right? So, yes, I would say, like, really, I mean, they call sitting the new smoking too. Like, you gotta, regardless of posture, you gotta get up, get blood flow back in through that part of your body into the anatomy. The pudendal nerve will love it. The pelvic floor will love it.
Yeah. So the problem is both, as you say, like potential asymmetry and loading of the pelvic floor, immobility, or like lack of movement, which restricts blood flow. That's kind of the issues of sitting in one position too long. Is that?
Yes.
Yeah.
Yes. Just, yeah.
Okay.
Yeah. And it's so interesting because we got really busy through the pandemic and COVID because what was everyone doing? They were sitting at home on their laptops like this.
Yeah.
Right. So sitting on their sit bones, ischial tubes, probably not like in this great position, balanced with the tailbone and the pubis, and stress through the roof. And so that also turned on the pelvic floor more. But it was very interesting. I was like, wow. We really saw the consequence too, physically. And then speaking of postures too, like going into a standing position. So if we have like these routine, habitual postures that we utilize, for example, just related to maybe our role like as a new mom, who carries their child or their toddler on one side of the pelvis or one hip, right? Who's trying to multitask. So I'm going to get you over here and I'm cooking over here with this hand. And if you do it again and again and again, once or twice, I don't want to be an alarmist, right? Where it's like, yeah, that's fine. The body is dynamic and the body is meant to do all these things. I think where people get into trouble is when it is, it's not just a couple times, but it is like year after year after year, because you'll get some adaptive shortening with musculature, with fascia, right? And if you have a biomechanical issue that's already started before you're holding that child always on that right side and you have a scoliosis where one side of the pelvis already sits asymmetrically higher, like mine does on the right side. Like when my kids were little, I had to be careful where I'm like, I don't want to reinforce that and cause my quadratus lumborum, which is a muscle right in there, to shorten even more. And the fascia of that muscle is continuous with the fascia that surrounds your colon, both the ascending and descending colon, which then is continuous also with the fascia that runs down into, we call it in through the pelvis. And so into like the intrapelvic fascia in through that region, which will influence the bowel and the bladder and the pelvic floor. So we just see a cascade of things happening. So it's a lot of awareness then that we bring to patients and education, like, okay, right? If you're going to hold your child on the right hip, then, first thing in the morning, next time you pick them up, it's on the left side. right? So not to say like you can never do that, but let's be smart on how
Yeah.
you're going to do things like that.
Oh, I'm guilty of that. I always carry like a shoulder bag with me,
Yes.
and I always wear it on my
On,
left shoulder.
ah,
And I know that from working with a really skilled physiotherapist that I have like one part of my body that is stiffer than the other, or as is more tight than the other, which is bound to create some like impact on the pelvic floor as well, right?
yes, yes. Because your body it's a full system, it's all
Mm.
connected. So it happens at the shoulder, right? Even if you're elevating on a subconscious level or
Mm.
supporting, there's a fascial sling. This, like, if it's the left shoulder, your right side of your pelvis and your hip are working to stabilize that left shoulder. It will
Really.
absolutely influence things all the way down.
Yeah.
So again, we want to mix it up. Also, we want to mix it up on the brain level too,
Yeah. Yeah.
right? For neuroplasticity. Like if we do the same thing again and again and again, right? We're not really even challenging the firing patterns on the brain. So, like simple things, like if you're going to unload the dishwasher, instead of always doing that from the left side, go to
Yeah.
the right the next time. And then you're going to notice, like, okay, I have to sequence things differently, right?
Yeah.
Which is wonderful
Yeah.
for brain and body.
Yeah, I also heard a tip once similarly to switch up the positioning of your cutlery in your drawer from time to
Yes.
time, which is also a good one, like a
Right.
simple little thing to
Like
just like
simple.
create the
Great.
pattern in your brain. Yeah.
Yes.
Yeah, it's
Yes.
interesting.
Yes.
But okay, what about other like one thing I always do is sit with my legs crossed. I know that's a big
Yeah.
no, right?
So I know we're both doing it right
Yeah.
now, but so this could be our cue to like, let's switch.
Yeah.
Get the other side. Let's give it a break and shift the pelvis differently. So I think it is the most important thing is letting people know that you can still get away with doing these things, but let's just grade it and not do
Mm.
it for long periods of time. And let's mix it up too. So the body also, which is dynamic, can get used to maintaining different postures.
Yeah.
And if that side was compressed, let's elongate it now, which right now my right sit bone feels much better lowered down towards
Yeah.
the seat.
Okay, interesting. Because I actually thought it was like a big no-no, like full stop, not to sit with your legs crossed at all. That just
So,
inherently creates tension.
right. And I want to be careful of saying absolute
Yeah,
contraindications because then that creates fear, I think, for patients. And
yeah,
we don't want that, right? So instead of like, absolute no, like, okay, let's just be mindful. Let's switch this up a little bit where it's like, again, you're okay to do that now and then, and you're okay to do it for a short period of time, but just not for, again, like the 8 hours for the full flight or whatever.
mm,
You're going to get in trouble. Or if you already are suffering with pelvic dysfunction, like,
mm,
okay, it's not even 8 hours. Like it could be, I mean, we have some patients where like, you got to get up every 15 minutes or you got to switch, right? Like we're going to pace, right? Maybe up, down, different positions on how you stand. So,
okay,
yeah.
okay, that's a helpful nuance.
Yes, it
Yeah,
is. It is nuanced.
yeah, exactly. Okay, what else? Anything else that you think is like daily things that we can be conscious about?
Yeah. Breath holding, I think, too. Sucking in your belly is another one that kind of comes with that. So I had a patient who was a car salesman. And so he was out on the lot all day. And so he had pudendal neuralgia and a hypertonic pelvic floor. And so we really had to dive in on, okay, tell me what you're doing. So I know you're out there walking, but he had symptoms because typically PN patients, when they stand, don't have pelvic pain.
Mm,
He's like, but I have pain out there when I'm walking. I'm like, okay, well, tell me what you're doing. You're not lifting. And so we finally identified he was sucking in his tummy all day
mm,
because he's like, I gotta look good,
mm.
right? Like, I'm gonna sell these cars, I gotta look good. So I was like, oh my gosh. So literally sucking in his tummy, right, for the whole shift. I was like, your pelvic floor is pulled up all day then, right? If you are not designed to do that. So we had to also, again, do that dance of like, you got to release and let go. It's not, right? It's not normal to walk around with your belly abdominal wall activated like that. So the
Yeah,
abdominal wall and the pelvic floor work together. So like really diving in and just starting to analyze too, like nothing in excess is ever healthy or good, right? Like
yeah,
that. I had another patient, like when we talk about holding, whether breath pattern or also even just holding our pelvic floor or back to bowel and bladder, she came in and she was referred in for stress urinary incontinence. So cough, laugh, sneeze, oh, I leak. So if a physician would have just handed her a sheet like, oh, strengthen your pelvic floor and do some Kegels. By the way, 50% of people do them wrong if they're just given verbal instruction alone.
Mm.
And it's so much more than just like firing your pelvic floor and doing Kegels.
Yeah.
But if she had even tried to do that, it would have backfired because when she got into the clinic, she had a hypertonic pelvic floor.
Mm.
And we even had EMG evidence, like we could see like at rest, just laying on the table, her pelvic floor was like, it showed with EMG electrical output, like it's already active and like too active at rest. She wasn't
Yeah.
doing anything. So now I had to go, I'm like, okay, we're going to release and lengthen the pelvic floor, but we always want to go one step further. Why did it even show up in the first place?
Mm.
Why was her pelvic floor so highly active just laying there on the table? So I had to go in and ask her more questions. I'm like, tell me what happens. Again, like, okay, do you push your pee out? We already talked about that. I'm like,
Mm.
tell me about your day. And she's like, well, I don't go to the bathroom at work. I'm like, what do you mean you don't go to the bathroom at work? She's like, well, the restrooms are disgusting. She's like, I can't go there. And so I'm like, so you hold your bladder for how many hours are you working? She's like, well, 8, but I commute. And so really 9. I'm like, not normal. Again, right? Like, no wonder your pelvic floor doesn't let go. And when a pelvic floor is hypertonic and actually too active, it actually becomes short. So therefore, it can't move through its full range of motion. When she would have increase in intra-abdominal pressure, like, oh my God, I'm going to cough, I'm going to sneeze, her pelvic floor couldn't activate to counterbalance that pressure coming from above, and she would leak. So her treatment program was very different than, again, like the Kegel thing, right? She would have failed because all she would have done was pull it in even more.
Mm.
So we had to get her to be able to find a strategy on how she was going to eliminate and empty her bladder while she was at work. So we talked about that, right?
Yeah.
And how we could get her comfortable doing that.
Yeah.
So she wouldn't hold, so that we could elongate the pelvic floor. Also, could go through its range. We treated her, elongating it. Her pelvic floor easily came back online to be able to do its job.
Mm.
We still strengthened her up. I mean, but that was short-lived. That was like 8 visits, like
Fascinating.
yes, where, we put it together with full body strengthening too, but
it can be the really small things.
it can be very right.
Yeah.
Or the things that we don't really think matter, but they do.
I love the point around like sucking in your belly or holding in your belly, because I was the first pelvic floor physiotherapist that I worked with, who was great. We were trying to identify patterns that was holding my pelvic floor in a hypertonic state. And the point around sucking in the belly was something she asked me about quite early in the conversation, and I hadn't really thought about it before. And I think I'd gone a long time just holding in my stomach all the time, but I've kind of taken it for granted, or that it should be like that. And it was just so liberating to have someone call me out on it and being like, "Okay, so you can just stop that right now." And that is, I think, one of the ways in which diet culture is also like been internalized in many women. So I thought it was quite liberating to have someone call me out on that and like actually do something about
And
it.
teach us something that's so counter like cultural. I think building on that, like when we wear super tight clothing too, like if we do a belt or we're like, let's cinch it in with our clothing, that also can backfire as well especially if you already have a problem. So I always like to tell patients, like, think of the tube of toothpaste. If you go to the middle of it and you just squeeze, where is all the toothpaste going? Up and down, right? We're not really emptying. And so now we have all that abnormal pressure coming down on the pelvic basin, and the pelvic floor is trying to deal with that. And then we have the pressure also coming up. So like those are things too. Also just think about, like, again, short periods of time, right? If you're going to go to a special event and you're like, I've got to be at this dinner, and that's fine, but not day in and day out.
So like shapewear, for instance, or something that became really popular a few years ago, these waist trainers. I don't know if you remember that, but I feel like that's luckily on its way out now. I guess that just creates a lot of pressure, I'm assuming. Lack of that natural movement between the diaphragm and the pelvic floor.
Correct.
Yeah.
Yes, because there's that huge relationship.
And so I'd love to move us into another area that comes up a lot, which is exercise. And I know many of our listeners will do some form of regular exercise, whether that is yoga or Pilates or something like that, where I feel like we're constantly hearing cues like engage your core or lift your pelvic floor or bring your belly button to your spine. And I personally also do a lot of Pilates, where one of the cues is often imagine that you're zipping up a really tight jeans. And that for me always just sends off alarm bells in my in my head, because I know I struggle with hypertonicity in my pelvic floor. But for someone with pelvic floor dysfunction, how should we navigate these cues?
Such a good question. And this is something that we really educate not just patients, but also our counterparts out there in the fitness world in. So number one, I think it starts with awareness. So awareness of the pelvic floor it needs to go through its full range of motion. There's a rise and a fall to the pelvic floor, right? So when we get cues, right, in the fitness world too about like, let's turn on the core, or even in the sports culture too of like, let's strengthen, 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 right? We have to have the counterbalance of the lengthening. So we have started like with our practice, we do a lot of workshops where we'll go and we educate in different environments. Like, for example, we go to, it's called Bar Studio, and we will go do workshops there to educate both their instructors and the clients coming in. Because with bar, like, I love it. It's amazing strengthening, but it's also a lot of external rotation and same thing like pulling in and up, right?
Yeah.
So you think of a ballet dancer and how they're trained. These
Yeah.
dancers, rarely are they trained how to release, lengthen, and counterbalance what happens then with that hip external rotation or excessive, internal rotation. So awareness, I think number one, having a balance of being able to work through like both ends. We're going to strengthen and we're going to lengthen instead of villainizing like and just saying like, again, you can never do that. Like, how are you with your training or your day in and day out activity going to bring in the other side of that?
Do you have an example of that? Like, is there,
Yes.
because there's some exercises, I guess, like some concrete exercises where we need to
Correct.
engage our pelvic floor or engage our core, for instance, if we're lifting really heavily, I'm assuming.
Yes, correct. We need the pelvic floor on. We need the core on. Absolutely. But then we also need to counterbalance and make sure that we can fully lengthen and release back to a healthy state. So I think so many people don't even have an awareness of what does it feel like, or why, A, do I have a pelvic floor? B, where is it? What does it feel like when it's in a healthy resting state? On the brain, we call it proprioceptive awareness. So finding that is critical. And then we can like talk about like in an example, like my 19-year-old daughter, she was a volleyball player and she played the position of libero. And so that's back row and you're always in a squat. Like you are ready because you're the one that's going to dive for the ball. So she overtrained in that position. And ended up with a hypertonic pelvic floor because, again, like in the sport, I had to come in and be like, we got to undo and lengthen that. She, because of the repetitive nature of it, and sometimes like working out 4 hours a day and squatting for 3 hours a day like that is not healthy or normal for that pelvic floor.
Yeah.
So we had to integrate then a routine for her to do on this is how you're going to lengthen. You're going to, at the end of every practice, you've got to integrate this, or midway through. I don't care what your coach thinks, or like you. Yeah. You got to go instead of a partial squat down to a full squat and release and breathe. And, and we got some things going at home and, between what she did with like, we call it like a peanut ball, and she would work and roll on the perineal muscles of her pelvic floor to lengthen and release those muscles. It is a dance. We have a Pilates like setup at our clinic. And so we always like, if we are going to strengthen, we do a dance of now let's do a lengthening move. We're going to strengthen. We're going to lengthen. Let's make sure you come back into a fully elongated state. You're going to generate a lot more force anyway, like when we look at muscle physiology. So regardless of what sport it is, I think then figuring out then how you're going to do that dance of like, okay, let me get the pelvic floor lengthening, breath work to be integrated. So like cyclists is another. We treat a lot something called the cyclist syndrome, which is pudendal neuralgia.
Yeah.
And so we've had a few men who that got them in trouble, like being on the saddle, right?
Yeah.
With those really small bike seats and just hammering hour after hour,
It's very
like
painful.
all the miles. And so it was very meaningful for them to get back to the sport, like
Mm.
eventually, right?
Mm.
But we did a dance of how are you going to, I mean, we're going to treat the hypertonic pelvic floor, but how are we going to grade eventually with the goal of getting you back to that? But how are you going to do it differently then?
Mm. Mm.
So that you have this beautiful balance and you're out if you're going to be riding, how you get off of the saddle and do these things. And maybe you have to stop and
Mm.
literally,
Mm.
again, do these 3 quick pelvic floor lengthening exercises
Mm.
to be able to get that whole pelvic floor into a healthier state.
Yeah. And for instance, say a case would be someone doing a Pilates reformer class where that cue is constantly being
Yes.
repeated, like engage your
You know.
core.
Yep.
Could then a counter be whenever that one exercise that they're doing is over, something as simple as just like laying still and breathing for some time? Would that be like
So
a counter?
yeah, like if
Or
you're on the reformer,
yeah,
then what you could do is you could actually use those legs and straps,
yeah,
right? You could
yeah,
actually use those straps to go into modified happy baby just to really lengthen out the pelvic floor, do some
yeah.
breath work with that. You could think about even coming up out into like a nice V position
Mm,
to get the adductor component, inner thigh area lengthened,
mm,
because when that's tight, that creates more
mm,
pelvic floor tension. So you could work on like some thoracic rotation. You could work on opening up the spine through the back. Like there's so many fun things that you would just intersperse with where you're
yeah,
like, okay, great. I'm going to lengthen. I'm going to strengthen. So,
yeah.
and it makes it fun. Again, brain neuroplasticity. You're like,
Exactly. So maybe a good recommendation is to maybe try to let the instructor know that
for sure.
you might be making modifications. Maybe they are well versed in the pelvic floor, has a
Yes.
good understanding and can guide you, or otherwise you kind of need to take responsibility yourself and make the modification necessary
Yes.
to not stress your pelvic floor too much.
Correct. Yes. Education for sure.
Yeah.
Communication, and forget about like if you're in a class setting, like keeping up with the rest of the people. They probably all have dysfunction anyway, right? Like maybe they're going to ask you like, what are you doing over there?
Exactly. What are you doing, happy baby, while we're doing?
Right. Exactly. Yes.
Okay, but those are really useful cues, I think, from you. I also want to touch on higher impact
Yes.
training and movement. So think like running, high intensity interval training, these
Yes.
type of forms of training, which are very popular, I feel like these days. Especially we're currently in LA area, and I feel like there's like berries equivalents everywhere with kind of the same format where it's all very high intensity. But for people with vulvodynia and vaginismus, what is your take on this type of exercise?
This
Yeah.
is such a good question because I think it gets controversial, right? And people, there's like 2 camps or schools of thought. So in this, my opinion has evolved over the
Okay.
years. So initially, if you have somebody that is so symptomatic with a hypertonic pelvic floor related to vaginismus or vulvodynia, where you have vulvar burning and you're like, I can't wear underwear, I can't sit, right? It hurts every time I wipe because of either the vestibule or the entire vulvar area feeling like it's on fire. Okay, that's going to be different than somebody else that may manifest like, oh, I have pain with sex and it is related to vaginismus, but I'm not as symptomatic. So high intensity, I think there's a time and a place for it instead of saying like, you will never do that, right? So I don't like to speak in absolutes. I like to say, okay, right now at this juncture in time, right, we're going to sequence with cutting out anything that your bony frame, your muscular system cannot adapt to,
Mm.
right? And if your strategy is that you use your pelvic floor to create stability and you bring that hypertonic pelvic floor in to create stability, we're going to undo that, but we're going to turn on other things. So we're going to go in a certain sequence and we're going to do that in a way to facilitate success, right? And not to do like a high velocity jumping type of activity in the beginning. So we can do things like in some patients, we may be in the water starting, right? If they can't even tolerate exercise on land. So the pool is a great way to work. And then we move them into like, okay, now let's do something gravity eliminated. Now let's actually put you up against gravity. Now let's challenge you in the 3 planes that we move, in the sagittal and the transverse rotation and frontal. Now, if you're adapting with all that and you're turning other things on to offload that pelvic floor, and your goal, we tie it back into their goal, is wow, I want to go try that one hit class,
Mm.
right? So we're like, okay, eventually, right, when we get to that place where your pelvic floor has learned it to be able to fire and not pull back into that hypertonic, concentric, contracted state, we can start to do the dance of that. So, one of the things that is so fascinating is the pelvic floor, when it is loaded, it can explode beautifully. And when I say explode, like fire
Mm.
beautifully. Okay. So for our patients that have like either prolapse or incontinence, those kinds of situations, we actually want to signal the pelvic floor either through hip rotation or being able to respond to what happens with that intra-abdominal pressure to be able to support, right?
Mm.
Do its job.
Mm.
So eventually we can bring it back, but we grade it. We grade it, right? So we might just start with like, let's practice this little step up and step down before you're going to do like a jump, right?
Mm.
So again, it's nuanced, but instead of like ever saying like, you will never do that, right? Now I'm like, if that's your goal, then we will work towards it.
Mm.
But in the beginning, yeah, don't go out and do 5 classes a week because are you kidding me? Right? Like if your
Yeah.
pelvic floor is already like this, all you're doing is reinforcing that until we can help you with that eccentric lengthening out, right? And
Yeah.
the
Yeah.
tissue, we have tissue creep and adaptability and figure out all the triggering things on why you developed that in the first place, then
Yeah.
that is going to backfire. Sequencing, I think, is huge.
And can I just ask one clarifying question just so I have it clear in my mind? Because say that you have a hypertonic pelvic floor
Yes.
and you do, for instance, like long distance running or something like that, that is
Yes.
a lot of like
Jarring.
actual
Yep.
impact.
Yep.
That is a lot of shock for the pelvic floor to keep on
Correct.
absorbing, right?
Yes.
That the combination of hypertonicity and that type of movement can be
Yes.
quite
So yes,
right.
right. If you are along, which we've had these patients come in, right? And
Mm.
they're runners, but this feeds their soul too, like,
Mm.
because they're
Mhm.
getting there. So we were like, we got to take time out, right? We cannot have you doing that right
Mm.
now. So do you ever want to run again? Okay. Yeah, we think we can get you back. But again, how are we going to do the dance and what is that going to look like? And so instead of pulling it from them 100% eventually, we try and figure out like, okay, how are we going to do that and do it in a graded way.
Yeah. Yeah.
Right. So, but yeah, in the beginning for sure. But that takes us to also like taking a full body approach too as pelvic floor therapists. Like we got to see what's happening with the foot,
Mm.
right? If you're a runner, because the mechanics of the foot will influence what happens with the pelvis and the pelvic floor. And if you don't fix the problem with the foot, then that hypertonic pelvic floor may just come back
Yeah.
even when you return to the sport or the activity. So we have to look outside the box as clinicians. We have to be looking head to toe with our assessment, foot to jaw to head, right? Tongue, all the stuff that, because it is all connected.
Yeah, so interesting.
Yes.
It's really alpha omega, like to have access to a really skilled therapist because there's a lot of like resources online, right, for people who might have vaginismus and trying to do some
Yes.
self-treatment for
Correct.
a hypertonic pelvic floor. But as you say, there's just so much nuance to it often
There
that
is.
we just can't really know all of it ourselves. And
And no system works alone, right? So
Mm.
the body is a system of connections, but also like no system in the body functions in isolation. So on Instagram, we did create a graphic actually probably about 3 weeks ago or so, maybe a month ago, but I loved it. And we just called it the pelvic healing tree.
Mm.
And so we like to say you can't treat the fruits without addressing the roots.
Yeah.
And so we have like the branches of the tree that are all the systems of the body, right? Musculoskeletal, nervous system, endocrine system, lymphatic system, detox system. So, and the leaves are up here like, oh, I have vulvodynia, I have interstitial cystitis, I have vaginismus, right? I have pudendal neuralgia or whatever.
Mm.
But then we go down into the trunk and we follow to the roots and we go, but what's happening at the root level?
Mm.
Okay. So even beyond like, okay, foot to head, the roots, what are systemic things that will influence all of that above? What, for example, what is my ability to detox, right? Maybe I have high levels of mast cell. We call it mast cell activation syndrome, right?
Mm.
That's influencing my vulvodynia, right? Because mast cells show up in the vulvar vestibule, unfortunately, if we don't
Mm.
break it down, and that can create pain and inflammation, and they can show up in the brain, and that can influence anxiety. And we're more into that and pelvic floor is back on, and they can show up in the gut, and we have IBS. And I don't want to tangent too much, but like I'm trying like big concepts is where we want to go
Yeah.
to also create more permanent healing. That's the goal.
It's such an interesting topic. What do you feel like what do you think is something that we can do to get closer to a treatment solution or a treatment pathway for women who experience vulvodynia vaginismus that tries to encapsulate what you're talking about just there, which is all these connections across
Yes.
different silos maybe that we're often
Correct.
operating in. Do you have like a dream vision of what treatment could look like?
I do. We coined it like the Sarton systems methodology. And this is part of my own journey with my own health too, where we now go in and we look at each individual system and then look at the crossover, because again, they don't work in isolation. They're working all together, and how one influences the next. And yeah, we have like in our intake and our history, we're going to ask all the questions that it's going to be very apparent if they have an endocrine system problem, right? With hormones or reproductive. And we're going to look at the GI system, and we're going to look at the nervous system, and we're going to obviously musculoskeletal as pelvic therapists, right? That's our specialty. But leaving those other systems out, the lymphatics, huge. Or the ability to detox, huge, right? Because if this patient's coming in with high levels of inflammation because they cannot detox very effectively, I mean, muscle and fascia changes in the presence of inflammation. And if you don't get that inflammation, figure out how to get them either to a practitioner, or you can guide them on how to dial it down, you're fighting an uphill battle, and you're only going to get so far. Make sense?
It does make sense, yeah, and it's so fascinating to hear about. And I feel like the people who get to work with you are truly so lucky, you and your clinicians, because you're obviously so passionate about this topic and you're in a position to make those connections. But I think that is unfortunately quite rare to find someone who knows as much. So I was really encouraged to hear how much you're doing outside of your clinic as well, and passing on this knowledge through your courses. So I think that's just an incredible initiative, and I'm so excited to see how that kind of will branch out and inspire clinicians throughout the world to bring on what you do in your clinic. It's truly inspiring.
Thank you.
Yeah.
Thank you. Definitely. My own healing journey has taught me a lot.
So I think we've covered a lot in this episode, and I'd love to leave our listeners with some really actionable recommendations. So I'm curious to hear, what would be your top 3 daily habit changes that could make the biggest difference for our pelvic floor?
Okay. Top 3. Number 1. We've already touched on these through our conversation, but give your nervous system some love. So get that nervous system, which most of us function in today's world more into sympathetic versus parasympathetic. You know, the stressors that we are faced, we run around like in that overdrive, sympathetic nervous system overdrive state. So that will keep your pelvic floor on. So, you know, you talked about humming with elimination. We'll just hum anyway, whether you're peeing or pooping, right? Like, right. So, I mean, it's so interesting because a lot of times when I'm talking to somebody, I have my hand. I always thought I was just putting it over my heart, but it's sternal pressure. Sternal pressure helps activate the vagus nerve. And for those that don't know, like the vagus nerve is a cranial nerve that helps regulate our nervous system and can get us into that like parasympathetic healing state.
Yeah.
So simple things, right?
That's so interesting. I always very instinctively also put my hand over my chest. For instance, if I'm driving, I very often find myself doing that.
Yes.
I find it so relaxing.
And when I started learning all about vagal nerve, like strategies, I'm like, wow. Yeah. And that is the beauty of all of our bodies, right? Like we're already intuitively kind of set up to like help.
Yeah.
We just didn't realize what we were doing. Well, so simple things too. Like in the morning too, if you can gargle, that's another vagal nerve thing, right? Or just gently massaging the front part of the neck. So come from behind the ear down, because the vagus nerve travels right through this region. Like just give it a little bit of love. Breath work, right? Meditation, prayer, anything just to get that nervous system like dialed down, and it can be on the go, cumulative through the day. It doesn't have to be like, I need to do this for 30 minutes straight. Yeah. So plug it in. Number 2, I think next thing is have an awareness of the pelvic floor, and then get into a position every day somehow to release your pelvic floor, whether you have a problem or not. Let's be ahead of it. Let's do something healthy. This is a very important muscle group. I think the all-time most important muscle group of the entire body. So, like, drop into a full squat. Just drop down into a full squat. A partial squat is going to activate the pelvic floor. Like, drop down into a full squat.
Almost touching the ground type of
Yep.
squat. Yeah. Okay.
Yep.
I struggle with those, but I'm feeling inspired now that you're talking about.
And you can drop down using the wall as a support, or you can
Yeah.
hold on to a nice piece of furniture, get all the way down. It's like you're going to, for us women, like pee in the woods type squat, right? Like to release fully. But just do that and then go ahead and take a couple nice deep breaths there too. So now we get that full range going again, the diaphragm and pelvic floor. Like, how easy is that? And how long does that take, right? Something super easy and fast.
Can I ask one question about that?
Yeah.
Because when I do a full squat like that, I find that I struggle to keep the whole sole of my feet in the ground.
Yes.
Is it still effective if my heels are lifted?
Absolutely. And what you can do, because if you have tight calves, so the gastroc and the soleus, those are muscles of the calf too, and they come down and then converge. And so if that heel cord is super tight and you just don't have the range to get all the way down, you can simply either, because I'm a little bit tight too. So like if I were to get up, I could use the edge of this couch and then use that to drop down to support me, or the wall. Or I could use a towel roll or something underneath my heels, so I have full contact.
Yeah.
So but it's absolutely, even if you don't have, you're like, I don't have time for a prop. I don't have, yes, go all the way down into the position that you can achieve and fully let go. But you're hanging out on the bony structure, the muscles aren't doing anything, right? So if you can use a wall or a piece of furniture as a prop, that would be great.
Do you have any other favorite pelvic floor release exercises?
Yeah. I also, because so many pelvic pain patients will also have a component of spinal issues as well. So it's a really simple one, but there is a tweak to it that I like, which is, modified happy baby is one, but child's pose is the other. Historically, in child's pose, a lot of people in terms of hip position actually usually have the feet pointing in. I want you to just come to neutral, or actually the legs pointing out, to separate the sit bones in the back. So when we bring our feet in together, it'll bring the sitting bones together, which the perineal muscles will then become shortened.
So kind of like toes touching.
So we want to do the opposite,
Swinging out.
Swinging out, which feels a little unnatural, but it is so much better, particularly if you have pain with sitting, but to get the superficial pelvic floor muscles to really lengthen out. Okay. And then you can do breath work. And again, if you need to hug, like either, a bolster or blankets, and then move with all of these things too. Like, you don't have to just go there and be static. When you're in that position, whether you're in a squat or if you're going to do your child's pose, shift your pelvis into every different direction and feel where the restriction is. Almost like a dance, right? Because we're dynamic beings. Feel that, get it to move and go like, okay, well, on that right lower quadrant, like that feels a little tight. So I'm just going to hang out there and maybe shimmy back and forth a little bit. So make it dynamic.
Yeah. And tying back to nervous system regulation, I feel like that for me often gets me very much into a restful state, or what feels like a very restful state, and just like getting a bit more into the body and out of the head.
Yes.
When you're moving a bit intuitively and like in all different directions. I find that incredibly relaxing.
And throw in your favorite music, right? Feed the soul, do whatever.
Yeah. And do some humming at the same time.
Do some humming, right? Sing low. Because even tone, pitch actually influence all of it. So so simple things like that. And then third, I would say would be, we already talked about inflammation. Think about any way you can drop your inflammation, because again, muscle and fascia changes in the presence of inflammation. So simple things like start reading labels, look at the foods that you're eating. Try and stay away from things like seed oils, right? So many, not all, but so many things that we buy here in the US and restaurants that we go to, things are cooked in canola oil and like the really unhealthy oils, and
Mm.
that will increase your omega-6 level, which is inflammatory.
Mm.
And we want this omega-3 to omega-6 balance to be 1 to 1.
Yeah.
So omega-3 is anti-inflammatory, omega-6 is inflammatory. And so
Mm.
it should be a 1 to 1 ratio in our diet. And the average American diet, it's 1 to 20. 1 to 20.
I've heard that's
It's so
terrifying
bad.
stat. It's a terrifying stat. Yeah.
So, you could be like going to pelvic PT, and you could be like doing all your exercises, and you could be even eating a salad and you're like, oh, this is so good. I'm eating all my greens. But
Mm.
then you drench it with some salad dressing
Mm.
that has canola oil as a base
Mm.
and preservatives and other things. And that is inflammatory. And you're now driving the inflammatory level up,
Mm.
right? It's going to make everything else that you're trying to achieve that much harder.
Mm.
Help yourself out. Just simple things. Like, I read labels all the time now.
Yeah.
And it's super hard to find salad dressings that are like made with either olive oil or
Yeah.
I don't know what's another good oil, like avocado oil, right? But yeah, or eat whole foods and cook at home. Which I know is hard because
Yeah.
I don't like to cook, but
I love hearing that connection because it's not something I hear talked about a lot within a topic of vulvodynia and vaginismus and pelvic pain. I hear some talk about diet in the form of oxalates. That's
yes.
something that comes up a lot, but never like this, or very rarely this like holistic way of thinking of inflammation in the body. So that's interesting that you mentioned.
Yes, so big. Food is
Yeah.
medicine,
Yeah.
right? Or it can be harmful too. And I mean, I have had patients with interstitial cystitis or vestibulodynia.
Mm.
I mean, leave the country. And one went to Italy for the summer, and she
Mm.
was a teacher and teaching there. And she came back and she's like, my IC symptoms were so good. Well, first of
Mm.
all, that's like a whole nother topic. But so she goes, I ate everything, Julie. I didn't even have to follow the IC diet. I'm like, like tomatoes? And she's like, yeah, the pizza and the pasta. And it was all amazing, right? Because much cleaner ingredients, I will
Yeah.
say, over there.
Yeah.
But so diet, do not underestimate global inflammation.
Yeah.
And so that's why fish oil for me will always be something that I take because
Yeah.
it's an anti-inflammatory thing. And I use it every day as a cancer survivor, and I use it every day as somebody who suffered with endometriosis, which is a chronic inflammatory
Yeah.
disease process, right? So getting that omega-3 to omega-6 ratio more dialed in.
Yeah.
And I mean, it made a huge difference with when I'm now menopausal, but my pain with my menstrual cramps that used to take me to the floor or cause me to throw up if I wasn't pumping 800 ibuprofen before I learned all the holistic things and pelvic therapy. And so, yeah, it is talk about systemic influence.
Yeah.
Do that one
Yeah.
for sure. It's
Fantastic.
harder than it sounds, but
Yeah. Exactly. Oh, but thank you for those actionable tips. I really appreciate that. And I think this is a good place to end our episode. It's been so nice talking to you. Again, I just hugely appreciate you taking the time to share your knowledge so generously. And yeah, it's just such a pleasure talking to you. You're a real like firecracker and so passionate about this topic. So yeah, real pleasure.
Thank you for having me.